whatever the external environment's doing to us internally as an organization, we have to adapt to it, or we have to respond to it. So yeah, we do that. Basically what we respond to though is there are patients coming to our hospital. Some can pay, some can't. Those that can't, we may still treat. We for sure treat them in the emergency room, but those that do pay are offsetting those that can't pay. And as long as that equation works, we're okay. If that equation gets out of whack, then you gotta do things internally to get your cost structure down to make sure that you can still exist as a hospital.
So how it impacts the patient, let's talk about that for a second. So you're out of work, you don't have health care, you've lost your health care, you don't have as much discretionary income, so maybe you forego your high blood pressure medicine. What does that lead to? That leads to sicker patients. Patients have strokes, patients have heart attacks. So when they enter both of our hospitals, they're sicker. We still have an obligation to treat them, and we always will treat them through the emergency department. But it changes a little bit of the dynamic of the type of patients we get. We don't get as much patients with elective surgeries because that's, again, discretionary income that we have in these kind of times.
This is my 5th stop along the way since 1981. So I've seen healthcare in Florida, Georgia, Mississippi, California, and now back to Georgia. We have a very good health delivery system here in Gwinnett County, one that we're very proud of, and one that we'll compare to any other system out there in the United States. We know our outcomes are very good. We measure those. There's metrics that we use to determine how well we're doing. In our case, the board sets quality goals. They spend as much time on quality and safety as they do on the financial statements. So we know that we're providing good care, and we know that we want to provide even better care, and we want to have the services that are needed, the physicians that are needed, and those sorts of things. So Gwinnett's blessed. The other thing Gwinnett has is proximity to Atlanta. So if there are those quaternary things that we can't do, if there's a burn patient that needs care, there's a burn unit at Grady, and so we're close to those services. So how do you respond? I guess from experience, I know that this is a good county delivering good health care.
I started my career as a nurse 30 years ago, and nursing care, physician care is better now than it was 30 years ago. A lot of that is because of the research and what we've learned about how to care for patients. A lot of it is the transparency. I mean, our quality numbers are available to anyone who wants to access them. We talk a lot about patient safety, keeping patients safe in our hospitals. We didn't talk about that 30 years ago. So I think we're in a great place. Start with Loganville. Families want to seek care close to where they live. Loganville is our #1 zip code as far as our market share. It was important to the physicians that practice in Loganville to have imaging services available close to where their practices are and where the patients live. And so we are going to be opening first or second week in April an imaging center that'll have ultrasound, it'll have mammography, bone density, a CAT scan, an MRI, anything that they would need for that area.
Okay.
On the heels of that will be expansion of our emergency department. We've outgrown our emergency department, and so we're going to be about 40% increase in size, and that'll help us. Patients who are sick want to come in and want to see a physician as quickly as we possibly can get them seen, and so that'll help us accomplish that goal.
Well, we're in the planning phases now, which is that's the boring phase for me. But we started that process fall of last year. We expect to have a brand new facility open. It'll be about 33,000 square feet by the fall of 2011, and that will house not only the ORs, the operating rooms for the hearts, but it'll also have some cath labs on the floor below that, and storage on the floor below that. So it'll be finished, and we'll be doing hearts in the fall of 2011. It's possible that we can do them before that, but we would have to utilize existing space to do that, and that comes with some challenges. So we don't know whether we'll do it the fall of this year or the fall of 2011, but for sure no later than 2011.
Okay.
Now, what's that mean for the future? More patients can stay in Gwinnett County to have their hearts done and have their interventional catheterizations done. And what that means, we believe, is that there's better outcomes for those patients, because just like trauma, time is critical for the heart muscle, and once it is without oxygen for a certain period of time, or blood, then it dies. And so far we don't have anything that'll bring it back. And so even if you live, sometimes you're cardiac crippled. You can't go out and do the things you used to do. So we think it's a better quality of life issue. We think it's better to keep patients here in Gwinnett County if we can treat them. They don't have to get on the highways. It alleviates traffic congestion, theoretically. And the more patients that stay in Gwinnett County, the more patients that will be seen by Eastside and by us. So that we just think it makes sense overall. It's good for this county.